Hi, good afternoon. I'm Dr. Magadi. I'm an infectious disease specialist. I'm also the chief of staff for both Regional Medical Center and Stringfellow Memorial Hospital here in Anniston. I'm also one of the lead physicians at the COVID ward. I'm excited to tell you some good news today, at least the community. We are down to 2 patients in-house. So those 2 patients are housed in our negative pressure room. So the COVID ward, as we know it, no longer exists as of now. So those 2 patients, one on the vent, are currently in the TB room or AFB negative pressure room. The regular COVID ward will be opening up for regular medical, surgical, non-COVID patients in the next 1 or 2 days. So we're just cleaning them up, but hopefully it stays that way. We have those 2 COVID wards. We have 4 negative pressure rooms, so we could house ideally 4 COVID patients there, and currently we only have 2. That also goes to say that the positivity rate in the whole county is down as well, and therefore the hospitalization rate for the past 2 weeks, as of March the 5th of this year, for 2 weeks we only had 8 COVID admissions. So for 2 weeks we average about half a patient per day that we are admitting. So about 1 patient every 48 hours that we're admitting for the past 2 weeks. Compare that to about 1 or 2 weeks before that, wherein we were admitting about 5 to 7 patients a day. So that's a significant drop. So that's really good news. So the town hall community update today is very short and sweet. We just want to relay that good news to you, especially the people in Calhoun County. We also want to, I want to explain a little bit on the new CDC guidelines on mask. I've been asked a lot of questions, including from physician colleagues of mine. On February 25th of this year, CDC issued a new mask guidance, and what they were suggesting is it's based on counties' data. So they group counties into 3 groups. One is low risk, green, medium is yellow, and high risk is orange. And if you go to cdc.gov and you type in Alabama and Calhoun County, we are at medium risk or yellow. What that means is in medium risk community like ours, you have to balance your risk as far as your individual risk. So if you're at risk for having severe COVID, you have conditions like diabetes, high blood pressure, heart or lung condition, and you're a transplant patient, you're getting chemotherapy, you're somebody at risk for developing high risk COVID, you might want to talk to your healthcare provider about continuing wearing mask. But other than that, the CDC and the rest of the federal governments are kind of loosening up their mask mandate to the point that a lot of people now, Walmart, Sam's Club, Target, they're not really wearing masks anymore. But the caveat to that is, as a healthcare organization in the hospital, nursing home facilities, we are still universally requiring people to wear masks, including our healthcare workers, for several reasons. Number one, we take care of patients, not necessarily COVID patients, who might be at risk for developing severe COVID if we don't wear masks in front of them or around them. So these people are sicker. These people have medical conditions that really put them at risk. They might have some kind of surgical or intervention that would make their immune system weak. So we prefer that people in the hospital, whether you're visiting or doing some other thing, non-medical business in the hospital, that we prefer that you still wear a mask. So that's still very good news. I think we're getting some semblance of normalcy especially in the next couple of days or so when the cases are really coming down. But this update or this community update is not complete without me telling about those words or letters that I tell you about every single time, the WWWV. Wear your mask again, depending on where you are, depending on your risk factor, personal risk factors. Wash your hands always. Wash your distance. So that also depends on your risk factors and depending on your facility that you're on. And vaccinate if you haven't been, or booster if you're eligible. Other than that, I think this is a short and sweet community update. Thank you for listening, and you guys have a good afternoon. Thank you.